Our next speaker is Dr. Williams, and I'll let him introduce his presentation.
Good morning, ladies and gentlemen. My name's Paul Williams. I'm a veterinarian with MSD Animal Health. So I think we'll all recognise that bovine respiratory disease is a significant cause of both animal implications on animal health and welfare, and obviously big losses on a global scale. But actually at individual farm level, it's really, really important that we try to find ways of getting accurate levels of the sort of prevalence of disease on a unit and actually the cost. Because once we've got a true sort of estimate of that, then that allows us, when we're putting intervention programs into place, to try and sort of get a feel for their success. And I suppose traditionally what we tend to do if we're looking to sort of take an assessment of BRD, then we look at clinical cases, so how many animals we're seeing sick and how many animals are being treated, and probably how many of them actually are dying as well. But in essence, it can be quite crude because it's dependent on the accuracy of clinical detection, and perhaps it's not actually going to pick up any sort of subclinical disease. And the other thing that it doesn't do for those animals that recover, it doesn't allow us to actually assess what the long-term impact on the animal's lifetime performance is with regards from having a case of pneumonia. So I think the question is, are there other sources of data that we can use to add to this to get a better picture of what might be happening on an individual farm with regarding BRD? And certainly one of those might be the use of abattoir data, because in many instances it's quite or relatively easy to get hold of at a low cost. And this was just results from a study that I did back in 2007 with bull beef animals that was slaughtered at 14 to 15 months of age. And what we found in this study is the animals that had the most severe lung damage actually had a reduction in their daily live weight gain by 200 grams actually over the animal's whole lifetime rearing period. So a significant reduction in their performance. So what we set out to do with this study was to actually look at the prevalence of lung damage that was occurring in animals in slaughter, to actually see, could we repeat that? Did this have an impact on these animals' performance? And also to try and tie that back, so to see if the presence of lung damage at slaughter, how is that associated with the actual animal being treated for BRD? And the study population, it was a UK veal cattle, which are typically killed out at 6 months of age. And it came from two producer units. And we had 189 cattle enrolled in the study. And as the animals were slaughtered and the lungs were coming along the production line, they were inspected both visually and palpated. And we assigned a score to each lobe. So if the lobe had no consolidation, that lobe got a score of 0. If it was less than 50% consolidated, it got a score of 1. And if it was greater than 50% consolidated, it got a score of 2. And we have 6 lobes in the calf lung. So in essence, the maximum total score for a lung would be a score of 12. We also had some additional information. So from the abattoir, we had the carcass weight of the animal. And from the producer, we had the date of birth. We had the animal had a history of a BRD treatment. And we also had the producer name. Now, I did mention that the target is to kill these animals out at 6 months of age. But there certainly was some variation at the actual age that the animals were killed. So sort of to account for the variation in age and the impact that's going to have on an animal's live weight, we actually calculated an estimated live weight at 182 days of age. And we did that by taking the animal's age at arrival on the producer's unit and the weight on that arrival, and looked at the age of slaughter and again the weight of the slaughter, and we drew a linear line between those two and just looked at what where the 182 days transacted that line. So that's just to show a graph of the distribution of that estimated weight, and we've got on the x-axis we've actually got the weight, and obviously you can see that it's a relatively normal distribution around that population mean. So what this graph shows is just actually we're plotting out the mean weight at the animal's lung score, and on the x-axis we've got the lung scores through from 0 to 10. So we didn't actually have any lungs that had scores of 11 and 12. And on the y-axis, we've got the estimated live weight. And I think that you can see that there's a general trend down of the mean live weight as the lung score increases. But you can probably also see that as we get more severe lung scores, the actual range of the confidence interval is increasing dramatically. And that's because really we didn't have many animals actually with those high lung scores. So what we did is to help with this, the analysis, we actually categorized the lung scores further. And what we did, scores of 0 to 1 were classified as normal to mild. Scores of 2 to 4 were classified as moderate lung damage, and scores of 5 or above were classified as severe lung damage. And again, just looking at those mean live weights under those classifications. So on the x-axis, we have the 3 classifications. There's 122 animals in the normal to mild category, 48 animals in the moderate category, and 19 animals in the severe category. And hopefully you can see that there's some significant differences between their mean live weights between those 3 categories. And actually, if we compare the moderate to the normal, there was actually a 16.3 reduction in that mean estimated live weight. And actually through to severe, actually quite a dramatic 52.1 reduction in live weight at 182 days. This is just to show the distribution of those weights. So again, the green shaded area is the normal to mild category, the orange is the moderate, and the red is the severe lung scores. And as you would expect, there is some overlapping between the categories, but hopefully you can see that generally the severe lung scores are towards the lower weights, towards the left of the graph, and the normal to mild green are towards the higher weights within that distribution. So I said we also looked at BRD treatment. So this is actually coming back from the producer records. And what we found is that 22% of the animals actually had a history of having received at least one treatment for BRD during their life. And when we actually did some analysis on that, we found that those animals that had a history of treatment for BRD were 16.4 kilograms lighter compared to any animals that had not had a history of being treated for pneumonia. Again, if we looked at that across the 3 categories, just to show the distribution, and what we did see, which was reassuring, that as we got increasing lung scores, so increasing lung damage, then the animals were more likely to have been treated for pneumonia. And actually, if we compared the moderate group to the normal, then those animals had 2.6 times the odds of receiving a treatment for BRD. And if we looked compared to the severe, then those animals had 5.2 times the odds of being treated. So that was good. We're actually seeing that they are picking them up and treating them. But you can see that actually if we look at the moderate and the severe, in the moderate we've got 33 animals, and in the severe we've got 10 animals that haven't been treated. And the worry is, are these being mistreated? Now, it is possible that the farmer is making a decision not to treat them, why, or maybe not recording that treatment, but it's probably actually more likely that they're missing the treatment, or perhaps actually the disease is, in these animals is being subclinical. So I think what we found from this is certainly we see that the lung damage that we see at slaughter is associated with significant impacts on animals' performance. And I think also that actually incorporating abattoir data into our other clinical data can really give us a true and a better indication of the level of BRD that we might be seeing on a farm. In this study, around about just over a third of the animals had either moderate to severe lung damage at slaughter. And perhaps what was more worrying is nearly 2/3 of those animals, so 64% of them, actually had no history of being treated for BRD. So potentially they're being missed. So certainly what I think it shows that perhaps we do need to work with our producers so they can become better trained in detecting BRD on those units. And certainly within the UK, we're spending more time now working with the producers, training them on scoring systems. Many of you will be familiar with the Wisconsin scoring system, so we're using that or it's slightly modified. But also the use of technology, with some of the earlier speakers were talking about, we have technology now, there's a picture of the ear tag or ruminal boluses that can just help detect early pyrexia in these animals. I suppose I just want to say lastly, clearly there's a lot for us to do to help improve treatment detection, but we mustn't forget that ideally prevention is much better than cure, and we do need to continue working with these producers to sort of improve both the environment and the management of them, and where appropriate look to implement vaccination protocols, again, just to help control BRD. So I'd just like to take the time to thank my co-authors, Tim Potter from West Point for helping to set the study up, and Richard Cooper from Evidence-Based Veterinary Consultancy for handling all the data analysis. And also thank you for the producers for allowing us to actually use their data. Thank you very much for listening, and I'm more than happy to take any questions you might have.
Paul's paper is now open for questions. I'm sure there'll be some over here.
Hi, thanks for the presentation. I'm George Valergakis from the Vet School of Thessaloniki, Greece. I think you said you have recorded when the treatment was given. Any effect of the time? Maybe some calves were not treated because they had BRD near slaughter?
Richard, you probably better answer that. I don't know if we didn't look at time of treatment and the relationship, did we, to... So I was going to hand over to Richard to analyse the data too.
Yeah, it was something that we have the data. We haven't, to be brutally honest, looked at that yet. It's something we'd like to look at in future with that data set, but for the initial analysis, we haven't quite got there.
Yes, Jansen from the University of Calgary. Did you do any further diagnostics on bits of tissue that you recovered from the processing plant?
Do you mean like diagnostics for pathogens?
Or histopathology?
Yeah, no, we didn't. There was no budget within the study, so it was just a visual inspection and palpation.
Is there one there? Oh, sorry, extreme right.
Giorgio Vada from Seva, Italy. If any, which kind of vaccination protocol did you apply in this trial? They were vaccinated or not?
So I'm going to actually refer to my colleague Tim in the audience, because I know that Tim knows the vaccination protocols better on the producers.
So the animals had an intranasal vaccine on arrival into the units and then had a multivalent vaccine later on. So they had respiratory vaccines.
Everybody happy? Okay, we move on. Thank you, Paul.
Okay.